Welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I'm Charles Aniegolu. Now, despite the cases of coronavirus being on the rise across Nigeria, many people in the country still don't believe that the pandemic is real. Fake news and mistrust in the government mean a lot of people in this country think the pandemic is a hoax. Well, I wish that were true, but sadly, hospitals in Nigeria, especially those in Lagos and Abuja, tell a different story. The COVID treatment center, which is managed by the University of Abuja Teaching Hospital in the suburb of Gwagwalada, has been at the front line of detection and response to the COVID coronavirus outbreak here in the Nigerian capital. And for the medical staff who place their lives at risk every day dealing with cases of the virus at the hospital, the battle against COVID-19 is very real indeed. Now, Dr. Felicia Anumah is a professor of medicine and dean of the Faculty of Clinical Sciences at the University of Abuja. Dr. Anumah is also a consultant physician and an endocrinologist at the University of Abuja Teaching Hospital, which manages the COVID-19 treatment center in Gwagwalada, and she joins me now in the studio. Thank you very much indeed for coming in.
Thank you for inviting me.
And we really appreciate the time, because this is obviously a busy period for you. But take us into the COVID-19 treatment center at the teaching hospital here in Abuja, where you often work. What's it like at the front line of the battle against the coronavirus?
Thank you very much. It's really not easy at the front line, at the hospitals where you have the treatment center. The healthcare professionals are actually at a big receiving end, if I put it that way. Because, for example, the emergency room in the teaching hospital, patients come and you have no idea what they have. It's only when you interact with them that, okay, the suspicion of COVID, is there. Initially, when this whole trouble started, we didn't have enough PPEs. So we go as usual, maximum you wear the mask, the coat, maybe gloves to see these patients. And then, of course, when we discover that, okay, there's a chance that this is COVID, we have a holding area where we put them, and then samples are taken for tests. When they are confirmed, then they are taken to the, treatment center, where usually they are for about 2 weeks, depending on how quick, how quickly they recover. So it's quite hot there, but people outside, that environment have no idea what is happening. I mean, I heard the DG of CDC Nigeria said just now, the truth is, up till this moment, people don't believe, Nigerians don't believe that there is anything COVID.
Absolutely.
In fact, somebody once told me that as far as he is concerned, this whole thing is a connivance between the medical professionals and the government. That's how some Nigerians think about COVID. Yeah, that is a connivance between the medical professionals and the government to deceive Nigerians. I think, first of all, one of the problems is that Nigerians don't trust government anymore.
Yeah, that is true.
And it's a very serious matter. Up to this point, even though in social media they hear about the death of this person, the death of that person from COVID, Nigerians are still not taking the precautions, the simple precautions that are very effective. And that is the cheap option that we have. But Nigerians are still not. You see the way they wear masks, that is those that wear at all. Some hang it on the neck as a necklace. Suddenly the mask has become a necklace.
It's quite extraordinary,
yeah,
isn't it? But given all that, and sorry to interrupt you, I mean, you've worked as a professor of medicine for many years. I mean, you're an endocrinologist, you're a diabetologist, you're a consultant to the World Health Organization, you're a fellow of the Royal College of Physicians in the UK, part of the Diabetes Society in America. Have you ever seen anything on the scale of the devastation that's being wrought by COVID-19?
Never. And particularly for those who have other morbidities. In fact, the most notorious of all the comorbidities, incidentally, is diabetes. That's the most notorious. So, and the reason is clear, because diabetes affects the immune system, you know, primarily. So they are not able to handle infections as usual. You know, simple infections, bacteria, viruses, you know, can cause a big problem in people with diabetes. So now you bring COVID comes, that requires that you have solid immune
immune system.
And that's why younger people seem to handle COVID better, because their immune system, you know, is strong.
Right, so let me ask you this then, because I mean, you've been at the isolation center, the unit at the University of Abuja Teaching Hospital, where anyone who tests positive for coronavirus is treated. What's the sort of age range of people being treated in that isolation unit? Do they vary in age, or are they mostly older people?
They vary in age. I mean, we have had patients who are in their 40s, okay? And then we've had older adults, 65 and above. Those younger, actually, many of them have, you know, comorbidities.
Right, so that's why they end up there.
But majority are older, you know, adults.
Right, so the symptoms vary.
The
because some are able to overcome some of the worst symptoms and others don't, and rather dishearteningly, you watch them die.
The severity of the symptoms vary depending on how much, you know, immunity that individual is able to, you know, build up. I mean, for example, young people, there are, as far as I'm concerned, there are many young people in Nigeria with COVID. No symptoms. The danger is this young person now takes it home and gives it to the older people who are there. That's the danger. So then you have people who will have mild symptoms. There was somebody actually, a young man in his 40s that I saw, who had a fever and he thought it was malaria. So he took anti-malarials, but he was still not optimal. So after a while he lost the sense of smell and the sense of, you know, taste, and then he started, you know, mild cough. He had diarrhea for 1 day, and that cough lasted 1 or 2 days, and that was it. He was in his 40s, but he had no other comorbidity.
Right.
Now you find diabetics come and they will have florid symptoms. Of course, blood sugar will get disorganized, and that alone is enough to make that individual ill. And then you have, you know, now the symptoms of COVID as well, the fever, the cough, difficulty in breathing, and then what we call oxygen saturation. That's the amount of oxygen that is in our body starts to go down. That's where the danger is. That's the most critical problem in patients with COVID. Once the lungs are so affected that oxygen exchange cannot take place, then oxygen saturation starts going down, and there is a level that is not compatible with life.
And presumably you've seen quite a number of those people.
Oh, yes.
And what does that do to you emotionally when you see their lives ebbing away and there's nothing you can do to help them?
Emotionally, it's very challenging. Very, very challenging, and psychologically challenging, that you see a human being dying from something that is actually preventable if simple measures were taken. So it's not very. There was a time in the teaching hospital we ran out of oxygen. I've never seen a disease in my whole life that consumes oxygen like this disease. In the treatment center in the teaching hospital, we need a minimum of 20 cylinders of oxygen per day.
That is extraordinary.
20 per day minimum. There was a time the chief medical director had to be screaming out everywhere, please, we need oxygen. Please, we need oxygen. So oxygen had to be sent from all manner of places to assist us.
And there's been a lot of allegations that successive governments in Nigeria have underfunded healthcare in the country. I wonder what you think about that and how that's affected the battle against COVID-19 in Nigeria.
Well, funding of healthcare in Nigeria has been a sore area for me. Why it is a sore area is because I deal with patients who have lifetime diseases, and these patients need so much support because they can't cope on their own. Unfortunately, in the Nigerian system, we mainly run what I call an out-of-pocket system. So because our insurance, national insurance health coverage, for example, is less than 5%. So in Nigeria, if you don't have cash in your hand, you may not actually be able to access health. So the government, making effort, but they need to do more.
But what is even more alarming is that we've seen quite a number of doctors' strikes. I mean, there have been protests against the lack of protective equipment and things like hazard pay and poor welfare conditions. I mean, how are doctors on your hospital staff coping with all that, as well as making themselves available to deal with
I think what has helped us with all those challenges, and we are still able to get focused and go on with what we have to do, is the fact that we see our job as a partnership with God to preserve life. So because of that, we know, we have the understanding that there's an aspect of this job that may not actually be paid for in monetary terms. So that, keeps us going. That is a life
that... Do you think that keeps the government going as well?
Well, I'm not so sure. I can't answer that, but that keeps us going because this is a life that we have a responsibility to preserve. No matter what, the issues around it are.
And in the context of COVID, I understand that staff are sometimes so busy that they have to sleep on hospital grounds and are sometimes not able to see their families for weeks. I mean, I don't know if it's happening here, but it's certainly happening in Lagos, which is a bigger city with more cases.
Well, I will tell you that it's not easy for the staff working in the isolation centers. First of all, for people to volunteer to work there, because you can't force anybody to work there. This is a disease that, you may get infected and die from. So you can't force anybody. It is volunteering. There are people actually females whose husbands told them, if you work in that center, don't come back to this house.
Good God.
There are people whose wives and children tell them, if you go there, you want me and your children to die. So because it is volunteering, we don't have enough staff. So people are actually pushed to the wall. But they are ready. They are doing heroic things, ready to work at their maximum best, just to see that lives are preserved.
That's quite extraordinary. And I think that these people deserve awards, people like yourself, because I mean in the UK, for example, there's all the stuff that's done for priority in every area is now given to healthcare workers, and they get additional safety things. But of course Nigeria, I mean, like, just looking at the way that you actually go in there, because you said initially you just wear masks, now you've got to wear the whole gear. And Nigeria's climate is particularly hot and humid. I mean, I'm baking in the studio right now, and I'm not wearing a PPE. I expect that makes the wearing of PPEs extremely uncomfortable and rather exhausting. And we've got about 30 seconds before we have to take a break.
Yeah, it is. It makes, people really sweat. But like I said, there's a driving force. The driving force is there's a human being dying. I need to do something to preserve that life.
If you're going to collapse in a PPE from heat, that's not going to be much good, is it?
Yeah, but somehow, I mean, if a white man, somebody from a temperate country comes to our environment now and wears the PPE, he may have so much difficulty. But we have some acclimatization.
Yeah, I notice you're not sweating at all, and the lights here are making things quite hot.
So we are used to our internal environment has adjusted to that temperature. So yes, we sweat in it. People sweat in it, but we are still able to cope.
Okay, well, stay with us. We want to talk with you some more. You're watching the Arise interview. Plenty more still ahead as we continue our chat with Dr. Felicia Anumah, Professor of Medicine and Dean of the Faculty of Clinical Sciences at the University of Abuja. Stay with us. Welcome back to the Arise interview. I'm Charles Anyegolu. Now, as you might have heard at the outset, Despite cases of coronavirus being on the rise across Nigeria, many people in the country still don't believe that the pandemic is real. Fake news and mistrust in the government mean a lot of Nigerians think the pandemic is a hoax. But with the rising number of cases and fatalities, hospitals in Nigeria are telling a different story, and the surge in new infections is making things particularly difficult and dangerous for the country's public health care system, already under severe strain even before the onset of the pandemic. And now there's evidence of a second, perhaps more virulent wave. And Dr. Felicia Anumah, Professor of Medicine and Dean of the Faculty of Clinical Sciences at the University of Abuja, which is in charge of one of the leading COVID-19 treatment centers here in the Abuja suburb of Gwagwalada, is still with me in the studio. Thank you very much indeed for staying with us. And the virus, of course, still circulating and mutating. And the variant that was first discovered in the UK has now been detected in a number of other countries, apparently including Nigeria. And the evidence seems to suggest that this new variant may be associated with a higher degree of infection and mortality. I wonder what your experience of this is on a practical level at the COVID treatment center.
Thank you. At the COVID center, actually we believe that the cases we've been having, is the new variant, because many of the patients present with more severe disease, and we have had more deaths in this second wave as compared to the first wave. So we believe really that we have, the variant in our midst.
That's extremely worrying, and perhaps also equally worrying is the fact that there are still not data emerging from some states in Nigeria about COVID. Apparently Kogi State has been classified as a high-risk state for COVID-19, with the Presidential Coronavirus Task Force officially warning Nigerians not to visit the state. And that is your state. What's going on there?
Well, I have no clue what is going on. I mean, I can't explain it, but the truth is this. We have had cases of, COVID-19 from Kogi State that have been treated in our center. Some have died. So we know that even a cousin of mine from Kogi State had to be treated in our center, in the teaching hospital here. And she never traveled anywhere.
So how much more difficult does that make things for the treatment of COVID in Nigeria?
It makes it very difficult because, the people tend to believe their leader. So once the leader says, don't worry yourself, so that's why leaders need to show good example to their followers. So once the leader says, don't worry yourself, there's nothing going on. The people, so what I tell the people, please take the responsibility of your health in your own hands.
And as you go around, Abuja, and sort of you see so many people not wearing masks. I think you touched on this earlier, or adhering to social distancing. All you've got to do is walk around this building. Things that people like you have emphatically said should be mandatory. How big a concern is that?
It's of great concern because these are simple measures that can make a difference between life and death. Simple measures, wear your mask and wear it properly. It's very important because I see a lot of Nigerians not wearing these masks properly. It's not meant to be hung in the neck. And some people wear it, they cover their mouth, they don't cover their nose. It should be properly worn, covering both the nose and the mouth. But Nigerians find it so difficult to obey these simple rules. Avoid, gatherings. Unfortunately, Nigerians love ceremonies a lot. We love ceremonies. And COVID-19, it's like they have determined that it's not going to deter them. They will go and do what they have to do.
They also are pretty excitable people. So yes, in the midst of that excitement, people just, vituperate.
They still plan their weddings, plan their parties, do everything without even putting COVID-19 into consideration. So Nigerians still want to do things the way they used to do it before. But there's an issue at stake. So we have to change some of our methods for now, at least until, we are free of COVID-19.
But do you think everybody's sort of relaxed a bit, though, including the government? Because, I mean, there is talk about, reinforcing lockdowns and things like that. Pronouncements are made, but they're not being enforced.
Yeah, I think there has to be some form of enforcement on the side of the government, because the way I see Nigerians is many Nigerians on our own, we may not actually want to behave. That's the way we are until, there's somebody breathing down our neck. So, and this is life and death. So I think we need some little, some more reinforcement, some more push, for people to obey these simple rules. I'm always saying, even when I talk about diabetes prevention, I say that in Nigeria, we don't have what it takes to handle the complications of these diseases when they arise, but these lifestyle diseases, because diabetes, hypertension, all they are lifestyle diseases, but we have a cheap option, and that cheap option is prevention.
Absolutely. And I mean, here you are, you've had all this medical experience. I mean, you just come across as a very unassuming person, but I mean, the brilliance behind that assumption is really could be quite intimidating. I mean, but going beyond that and just looking broadly at the work that you do, I mean, I wonder on a philosophical level how human beings blithely walk this earth when our existence is so precarious. I mean, all it takes is a random kink in our DNA or a chunk of food going down the wrong way and it's game over. I mean, and I suppose for you as a doctor, that fragility is driven home to you every day in the course of your work.
Yeah. It's I say that the medical profession humbles human beings because the profession is quite unique. It's the only profession where we have the privilege to watch a human being take his or her last breath. I think it's a privilege because that moment is a very special moment in the life.
It may be a privilege for you. For us, it's a horror story.
It's a privilege in a sense because it's a very special moment in the life of that human being, and we have the privilege to watch it happen.
Yes.
That's why I say it's a privilege. But you see, it's a privilege, but it puts a lot of responsibility on
and then
us.
It brings home to you your mortality, doesn't it?
It brings home, that this physical body that we adore so much, there's nothing to it.
And do you carry the weight of what you see in hospitals every day? Because, I mean, for the rest of us, like I said, it's like a horror movie, but for you, it's all in a day's work.
Yeah, we do, because it makes us appear like sober individuals, sober human beings. I mean, you hardly find a doctor so loud, because we know what we see. We know, for example, you see a patient very critically ill, even when you go home, that patient is there in your mind. You keep calling, how is she doing, how is he doing, till the next day. So that burden is there all the time, and that's why you find some of us, quite sober. We're sober individuals because we can see the other side of life. Just to put this in, I have an NGO, so I do medical outreaches from time to time. In 2019, I had a medical outreach that took place in Kwale General Hospital. We saw about 2,000 patients, and we did about 100 major surgeries. We found people who have carried fibroid that look like a 9-month-old baby. They had no money to go
I could listen to you all day, Dr. Anumah, but unfortunately I'm out of time. But it's been absolutely brilliant having you. Dr. Felicia Anumah is a professor of medical medicine and dean of the Faculty of Clinical Sciences at the University of Abuja, and is one of those in charge of the leading COVID-19 treatment center here. That's it for this edition of the Arise interview. Join us again tomorrow. From me and the entire team here in Abuja, bye-bye, and thank you for watching.